Dr. Robin Walker, a neonatologist at the Children's Hospital of Eastern Ontario, provides information and advice regarding smoking and drinking alcohol during pregnancy.
We know that a whole range of drugs impair growth of the fetus. Probably the most commonly used is tobacco, which both increases the risk of a stillbirth but also retards the growth of the fetus so that the babies are small when born. And the issues go on. Those babies born to mothers who smoked in pregnancy, for example, have a higher rate of crib death after they're born. So tobacco is a very bad drug to use in pregnancy. Alcohol is another. Alcohol also slows the growth of the baby, but worse than that, it affects the growth of the brain. So that babies born to mothers who used alcohol, particularly if they used it very early in pregnancy, even before they knew they were pregnant, can lead not only to a small baby, but to a baby with profound lifelong learning problems, for example. Other drugs, street drugs, like cocaine, can also impair the growth of the baby and can also have very significant impact on the brain of the baby. Most drugs are a problem. About the only thing that you can probably use fairly safely in pregnancy is caffeine. So if you want a cup of coffee, that's okay. But you should probably avoid most anything else.
Several high school students that we interviewed suggested that quitting smoking and drinking during pregnancy is difficult because they're stress relievers, and pregnancy is a very stressful time. Here's what Dr. Walker had to say about that.
Well, I think in the case of alcohol, while there may be some people who are physically or emotionally addicted to alcohol, most people are certainly able to reduce its use or eliminate it. And alcohol is such a profoundly bad drug for the fetus that we absolutely say to people, do not drink when you're pregnant, or even if you might become pregnant. We do appreciate that mothers who continue to drink during pregnancy probably do so because the alcohol is being used for a reason. So it's a profound stress reliever to a mother who has major issues in some part of her life, and we do understand that, but there certainly are programs directed towards pregnant women who drink that can help such mothers get off. And certainly if there is an unresolved issue in that mum's life, be it abuse in the home situation, or be it a mental health issue that's not been adequately treated, or whatever those issues are, the time they need to be addressed is during pregnancy or even before the pregnancy occurs, because alcohol is a terrible drug for the fetus. Tobacco is a little different because there's no question at all that nicotine is a profoundly addictive drug. And so for smokers, for the most part, smokers usually are addicted physically to the effects of nicotine. But again, tobacco does have serious effects on the fetus. So while most mothers may find it possible to reduce their use of tobacco in pregnancy, without special programs, they may find it very difficult to get off. And so again, there are programs specifically designed for pregnant women. Most physicians who care for mums during pregnancy, family physicians and obstetricians, are well aware of those programs. Okay. They usually combine behavioral interventions, if it's before the pregnancy, perhaps with the patch, or other ways to help mums get off tobacco. So really important, both tobacco and alcohol, that young people recognize these are things to get off before you get pregnant. But if for some reason you do get pregnant, it's even more critical that you get off these things before the fetus can be damaged.
What is the first thing a woman should do when she learns she's pregnant?
The first thing that a woman should do when she finds she's pregnant is make an appointment as early as possible with her doctor, with her family physician, assuming she has a family physician, because the family physician is going to check into issues like tobacco and alcohol and drug use, and it's going to be possible for that physician to identify those problems and to put the mum in touch with the right kinds of programs in the community in which she lives. Okay. Really early appointment is really important because some of these things have an impact very quickly, early in pregnancy.
Okay. And if you don't have a family doctor?
Get one. If you can't find one, go to a walk-in clinic. Those are run by family physicians. You can get into there the same week, if not the same day, and those physicians will know where you can go to get help. Use your common sense. If you are a young woman who is not preventing pregnancy, then you are a pre-pregnant woman, and that means you need to avoid tobacco, avoid alcohol, avoid other drugs, look after yourself. And if you do that, the odds are not only that you won't have a preterm or low birth weight baby, but you'll have a beautiful, healthy baby. And that's worth taking care of yourself and having a good lifestyle.
Okay, great. Thanks a lot.
Okay, you're very welcome.